Good evening, everybody. Welcome to the first meeting of the new committee year for Community Board 2, Health, Environment, Social Services Committee. My name is Brandon Smith. I'm the chair of the committee, and I'll ask each of the members of the committee to introduce themselves. Ms. Thurston?
Secretary.
Thank you. Mr. Newmark?
Hi, I'm Barry Newmark. I'm a public member.
Great. Mr. Varela?
Hi, Alejandro Varela, public member.
Good to see you again, Alejandro, or to hear you. I didn't see you on video. Want to welcome our new member. We're very excited to welcome Nicole McKnight to our committee. Nicole, do you want to briefly introduce yourself to everyone?
Hello, everyone. I'm Nicole McKnight, and as Brandon just mentioned, I am a new.
Nicole, maybe you're on mute.
Can you hear me?
Yes, yes, I can hear you. A little soft.
Oh, okay. It's
There we go. There we go.
Okay. It's probably something with the laptop. Hello, everyone. I'm Nicole McKnight, and as Brandon just mentioned, I am the newest member. I have been a resident of Clinton Hills neighborhood for well over 20-something years, and I have a background in healthcare policy, worked for the federal government for over 20 years, and I'm looking very forward to being part of this committee. Thank you.
Thank you. We're really excited to have you. Ms. Church, do you want to introduce yourself?
I'm sorry, I'm Carol Ann Church, Assistant District Manager, and I'm attempting to help a committee member get on.
No.
Sorry about the phone.
Thank you for that.
Thank you. So before we get started with the meeting, I just want to make sure everybody who's in attendance now, whether you're a member of the public or a member of the committee, knows that the meeting tonight is being recorded. So just be aware of that for your conversations, that this is being recorded. We've got a rather packed agenda tonight. We'll go into that in just a bit. I know that we have some liquor licenses laid on the proposal. I just want to say to anybody, if you're here for a liquor license, we're probably not going to get to it until 6:45, 7 o'clock at the earliest. So if you feel like you need to log off or you want to log off until then, I just feel like that's probably fair warning for you. First, before we get into the agenda, I'm not sure if we have a quorum here. Do we count that we have a quorum? What do you think, Jessica?
I think we do. We have 5 members.
Okay.
Yeah, I think so.
I think we got 5.
Our correct total, Caroline.
Yeah, that sounds right. Okay, in that case, I will ask for a motion to approve tonight's agenda.
I'll make a
So
motion.
moved. I'll second it.
Okay, I have Jessica on the motion and Barry on the second. Okay, all in favor? See, Barry, Alejandro, you're in favor?
I'm in favor.
I got Barry in favor.
In favor, yes.
Okay, great. I got Alejandro in favor. Nicole, are you in favor of tonight's agenda?
She's raising her hand, Brandon.
Okay. Okay. All right, opposed? I don't think we have anybody for that. No abstentions. Okay, the agenda's approved. I think I saw on the line we have Miss Macey here. So Ms. Macey, are you ready to provide your presentation?
She'll have to be unmuted.
Hi, good evening, everyone. I am ready.
Oh, great. So let me just say it's really an honor to have you here. Ms. Macey is here on behalf of the Fort Greene Senior Council, and we're going to be talking about COVID-19 impacts on the programs and services offered there, which we're really excited to hear about. So thank you very much for coming and for being part of our meeting.
You're welcome. Okay, everyone, it's going to be a brief so you can carry on with your meeting, and I have another meeting. I just want to give a background for everyone that wouldn't know about Fort Greene Council. Fort Greene Council has been around, this is their 48th year, at 966 Fulton Street in Community Board 2. It's our district. And we are a social services agency, human services. We serve seniors. Well, we usually say we serve from the cradle to the grave. We serve from 2 years old to infinity. So we have children's program, daycare and after school program, and a UPK program. And we have 13 senior centers, which they call now neighborhood centers. So how the COVID-19 affected all our programs. First, I'm going to start with the children's program briefly, then I'll get into the seniors. All our members are not 65. The Department for the Aging age is 60. So those of you who think you're not a senior if you're 60, you can join our center. You're considered a senior to be eligible to join any senior center run by the city, New York City Department for the Aging, once you're 60 and over. Okay, so the COVID-19 came, and our children's program, which is also located at 966 next door, which is 972, same building, it suddenly came to a halt. We were told, first of all, the parents took the kids out suddenly. And then after that, it happened so quick. Next thing I know, the teachers call in. And since then, the entire children program has been affected. It was coming on to summer. We were supposed to have summer camp for the children that are 6 to 12. And that's funded by DYCD. That came to a halt because there was no money to fund it. And of course, it wasn't possible. So right now for our children program, we're listening to the powers that be, the mayor and the governor, and the Board of Ed. Of course, they'll get information from them as to when and if we're going to open back in September. So that's where we stand. So with the COVID-19, we were doing for the last 2 weeks of the after school program, we were supposed to close in April. And we did do distant learning until we closed, that just for the school age. The little kids, they weren't the 2-year-old. The teachers were calling the parents and see what they can do with them, but it wasn't too much helpful for a 2-year-old. So that's where we are. Moving to our bigger population, they're 60 and over. And this COVID-19 has affected, though you don't hear a lot about it with seniors, there's a reason. It did affect the seniors really, really bad. Social isolation was the main thing. Social isolation and meals. So I'll give you an inside view of what you don't hear. The last day the seniors were here was on Friday, the 13th of March. And that was the Friday, the last day they were in here having congregate meal, which they come together and eat and socialize. And we were, and everybody that's sponsors, we were getting instruction second by second, last minute. So that was a Friday. We got a call to say, cancel coming back, tell them they can do grab and go. So we immediately, from Monday, which we started, they stopped coming on the 13th for congregate. And from Monday, March 16th, we had to cook the meal. They come by the door, grab it and go. So that went on. And then suddenly it was stopped. On March 30th, that was stopped by the city, if you're following the news. and they started with something with Get Meals from New York City. So what we were told to do, because my staff is still working, we're essential workers, we had to register everybody because our names and our system goes directly to DIFTA, to the mayor, whatever, whoever, if all of your seniors registered would be in the system. So each of my programs had to look in the thing, call each senior, whether it's 1,000 or whatever, make sure they want to clarify that they're eligible for meal, ask if they have nobody to cook, etc. Once they were qualified to get meals, we had to register them with the city Get Meal program. It started out by us calling 311 for any problems. And as you know, every second it was being changed. So eventually the mayor, that's all I'm going to say, the mayor turned it over, take it away from DIFTA and turn it over to the Department of Sanitation to do the meals. So at that point, yes. So at that point, we had to now, we're like going everywhere but the place. We had registered some people. The meals started to come. It was a big disaster. Then it was changed. The first thing is they changed vendors. Anyway, right now, to fast forward, the seniors, some were getting, some weren't. In the meantime, those that weren't getting for here, the CB2 from me personally for Greene Council, I reached out to the Department for the Aging and asked for permission for us to cook. I know what the mayor is doing, but we had seniors, one was 100 years, couldn't cook for herself. And I said, I want to do it and deliver myself, have my staff do it. So during that time, I did it twice. We served like 1,000 meals one day, all around, giving everybody who wasn't getting it. Eventually that worked out where everybody started getting the food. And then eventually it turns out they don't want the food because it's no good and a whole lot of complaints. So my staff has been very, very busy, and myself, that's why we're back in the office. People couldn't work from home because it's a lot going on and we need all the computers. So my staff has been in the office at 966 since about 2.5 months now. We had to come back into the office. So the seniors, though you may not hear a lot about seniors, and there's probably a reason on the TV, they're pushing for the children. The seniors were going through a lot, and I'm thankful that Fort Greene Council was able to help the folks, at least not all the time, with some meals. When we deliver those meals, I give everybody 5 meals, 1 hot meal, and the rest that we cook and put in the fridge. They call it quick chill. We quick chill it so that they would have had meat for a week, because I did not know whether the Get Meal program would have gotten to them for a week, and I didn't want them to be hungry. But like I said, since then, meals all over the city is being wasted right now. Seniors are refusing them because after that came in, everybody tried to get in private agencies. And so they're getting meals from here, meals from there, and they're picking and choosing. So hopefully that we'll get back to normal. So during this pandemic, what we're doing, every day we're making calls, and we were able to register over 2,000 seniors. Not register, we have to pre-qualify them to get the free air condition, which was the city, you heard about that, right? The city free air condition program for the seniors. So the people who live in NYCHA were supposed to automatically get it, but the other people that we have registered. So in this case, if you were a member of a senior center, membership has privilege, because only those names were in the city, and the city would send us a list of the names, and we would call them to pre-qualify them. And so we were able to qualify 2,000 people got air-conditioned seniors through our effort. And we're also doing everyday wellness calls, which is very, very important. There's a lot of social isolation. The seniors who live by themselves, it's very, social isolation. So what happened, I thought about how we can help them because they want to come back out. It's getting too boring now. We have a bench for those who know the area. There's a bench in front of the building here. We're opposite the Putnam Triangle. And right now, even though it's pandemic, they're getting bored. We're in here working, they cannot come in, but we're finding more and more of them are coming and sit on the bench, whether it's hot or not. Our center is being opened now as a cooling center, And I'm very proud and happy that the mayor made it for 60 and over for the social isolation. So we have been opening, I think it's 4 times we opened since they started the cooling centers. So people are able to come in, seniors are able to come in, and we have to follow the guidelines. We had training on the CDC regulations. And so the commissioner visited us last week, I think one day, checking our sites. And we were on the Channel 5 News, so we're doing well with that. So being isolated and can't come back, I started a Fort Greene, we call it the FGC Virtual Senior Centers. And we're open, the virtual centers, from 10 o'clock to 3 o'clock, Monday through Friday. And I will send Ms. Church a link after the meeting or tomorrow morning so she can share with everyone who would like to check it out, although you're not 60, so you can see what's going on. And if you know anybody 60 and over, they can come on, we register them online. So the virtual program, I'm just gonna describe a bit. We're trying to do every single thing that we did in the center. And I'm very pleased to say, you'll be surprised. Today in our cooking demonstration, we had 68 people. And you'll be surprised how the seniors be doing technology work class and all of that to show them how to use their cell phone and their computers, those who have. So it's becoming a big hit. This is our 3rd week. And we have activities from exercise in the morning, which you can take part in. It's busy, one after the other. And 3 is our last program started 2. Today, the last program was Black girls who quilt or who do craft. And we've upgraded ourselves. I bought equipment. So we have a studio now that we're still working on, but we're recording. Some are live from the studio, like the cooking and the exercise classes. And some are, those who can manage it, are doing it from their place. So it's amazing. I know it's working because if you sign on anytime, you'll see the seniors are so happy, and we're very culturally sensitive to all our members. So we have music. Lunchtime is from 12 to 1. And once that's over, then you have the cooking class, the cooking demonstration. Every day you have one, which is live. And we have whatever music they wanted to hear, they give them, and we do it. And I'm proud of my staff because everybody, I'm not paying to do this. They're learning overnight how to operate a camera, etc. And the people who are cooking are all the cooks. Every day at different center prepare something so the seniors can learn how to do it. Today we had a smoothie with garlic, with some healthy thing with, what's the green thing? Turmeric, ginger, and fresh fruits, mango and something. And what we did today, we raffle. All who came on, they had a raffle. They asked a question after they described what it is and the health benefits. Who remembered it, they won a prize, and the prize was a sample of it. And yes, we deliver in CB2. Doesn't matter where they live, the person that came on, so they put it in the freezer, and the driver came, put it in a nice bag, and they're feeling so good about it. We also did a raffle for the quilting we just started today, and anybody could have taken part in it. They draw it on the Zoom platform, the center, and 3 people won. So we hand deliver 3 of the kits of the material, the thread and everything, so they can work along with it. The others who didn't win, we're telling them where to buy the stuff and whatever. So we're not missing anything. We have everything that we had in-house. Fab also did a yoga week for us, 2 days, 1 week. And we're trying to work with them to see what else can go on to serve the seniors. So this pandemic has taught us, those seniors say they can't get into, I think they know more than I do now how to get in. They're familiar with the Zoom platform, so we're sticking with that. And they're getting better every day. And lunchtime music today, my staff check on because they have to check in people, and I go on sometimes just to see what's happening and how it is. And I'm very pleased they have lunchtime music, and the people actually get up and dance, and they are so happy. And we have tea time. Remember this when I send the link. On Tuesdays at, I think it's 1 o'clock. If you go to my website, fortgreencouncil.org, it's going to say Fort Greene Virtual Center. If you click it, there's going to be a link. It tells you the program and everything. So if you don't get it, just do that. And the topics, we're trying to end ageism since all the ageisms are done. And the commissioner said, you know, LIFT is fostering that. And we were doing it 2 years before. So the topics, tea with flowers, is like, I don't want to say Wendy Williams, but I call her Wendy Williams. But it's heart to heart, and you'll be very surprised how the seniors, you're live, and not because of their age. One of the topics was last week was, what was the topic? I didn't mention it before. The topic last week was a letter. They read letters, and the letter, the person was talking, that someone was, it ended up being, if you have a mother-in-law and your husband, should she sit in the front seat of the car if he come to pick you up? And you would see how their brain is going, and it's very, very good for them, and everybody's happy. This week, Tuesday, there was something that y'all have to listen to. It was about sex. And the seniors were so much involved. So Tuesday, I don't know what's their topic. I never know. I just join in. And tea with flowers, I think it's at 1 o'clock or 2 o'clock, but you'll see it online. So just pop in anytime. If we see you say Brooklyn, you know, CB2 or whatever, or they'll ask who's this person's name or whatever, because we see the seniors. And you're welcome to take a sampling. And if you know anybody 60 and over on the community board, you want to, if they're isolated, they can join our virtual centers. And if they live in community board too, it's going to be Grace Guard. We register them. And then everything else, we're going to start sending the samples of the food we make, any cooking from now on, if 2 people win. So we're encouraging them, and we see it's helping with isolation. I have one senior, don't remember her name. Every day I see her in her bed. But from the time she comes on at 10, she doesn't leave till everything is over, and she takes part. So it's giving them, and then some of them, one senior, the daughter came to him and realized this, and she's happy. So she comes every day, help him to get on and stay on with him and participate. So we have the intergenerational program, and that's all we can do on a local level, because we can't, well, I can't, maybe some of you can. I can't get closer to the mayor and the governor. And my opinion, I'm joining some groups, but it really doesn't help too much. So we have to take care of our seniors on a local level in Brooklyn and in this district and everywhere else. So I want to thank you for inviting me, Ms. Church. And I hope, and one thing I want to say with this committee, I don't know if it will be the committee. If we need any help from you, I will reach out to Ms. Church to see what the community board can help us with helping the seniors during this pandemic. So I want to thank you. If there's any questions, I'm open.
Well, thank you. I really appreciate your coming and speaking to us. And if we were in a real room in person and not virtually, we'd be giving you a big round of applause, I'm sure. But I wanted to ask you a couple of questions, and the committee, I'm sure, may have some other questions for you too. Generally speaking, about how many members do you have with the Fort Greene Senior Council? And when the pandemic hit in March, did everyone seem to stay engaged, or was there an experience where some people became disengaged because of the pandemic? And I was also just kind of wondering about the degree to which you felt like your seniors, the people that you work with, are appropriately equipped with personal protective equipment, masks, or if there were any issues or concerns that came up in the course of the pandemic in that regard.
Okay, this was Brandon, right? Yeah. Okay.
That's me. Yeah, sorry.
Okay, a bunch of questions that I'm going to try to remember. Start from the last that I remember. The PPE, yes. Of course, it was a panic because I remember in the beginning after the 13th, and it got real scary. I remember seeing all around here look like a ghost town. The seniors stayed at home. They were very, very scared. And I must say, a lot of seniors died from our agents from all the centers. We had about 25 deaths in the beginning from the COVID. So they were all inside and trying to be isolated. And then they got a little angry after a week or two that they weren't getting food. That's why I jumped in that. In terms of the PPE, I must give a shout out to some of our election officials that reached out to me immediately, including our Attorney General, and asked if I had PPE. She was the first one that called me. And so she had sent over some stuff immediately within an hour because nobody had the mask at that time. She sent over some, and after that, a couple more elected officials from the district did come in and give PPE, which we were able to distribute to the seniors' home. And after that, and it become more available, even the borough president came to my house and bring some for me to get here to them. So right now we're good with the PPE because Office of Management, the OEM people, they're sending PPE for the seniors that are open for cooling center. So when you come into the cooling center, if you don't have one, it's fine. We have it at the door. And we also mail to the seniors. So we were able to provide masks for the seniors. We were also able to distribute hand sanitizers. So those two things we were able to help with, and they felt a little more comfortable. Thank goodness, as of today, I don't think there's a shortage of any masks. So it's just now they're complaining which one they want. And this one that I'm holding up here, this is the best one they can breathe from, and it has a metal. So we're trying to get as much as these to keep and give to them when they come in. Because the ones we have are, look, this one here is what elected official brought. It's just a piece of terry material and they cut holes. And the seniors don't like this anymore. They can't breathe with it, especially when it's hot. This one was also a not elected official in the city. I think the people in the prison makes this one, and it's a double lining. So, and this can be washed, this can be washed. These are disposable, and we find the seniors are going more for this one. So we were able to do that. And if I didn't answer part, can you ask me? Start from the top. From the bottom, is there anything else that I missed?
Oh, I was just wondering about how many total members your group, your council has, and if there was any. I mean, I'm sorry to hear about the folks who passed away. I mean that certainly is tragic, and our hearts go out to them. But my question was really just in the realm of were there a number of people who just became sort of disconnected from the center because they moved into the Zoom culture and perhaps they just didn't take to Zoom very well?
No, first of all, we serve on a normal pre-COVID time about 2,000 people a day for lunch and about 1,500 for breakfast. And then we have dinner at some centers, like this center has dinner twice a week, and we would serve about 50 dinner every week or 100 between the 2 days. Now, I feel, and I didn't see a decline from their moving away. I think the people who can't get on Zoom now are very upset, and I'm trying my best. I don't know how advocating we can be. If we know Bill Gates, some of the seniors do not have an iPhone nor a computer or laptop. And my wish is that those that can't afford it and don't have it, and some of them don't have internet, so they call in on the phone and they're missing out seeing the stuff. So that's the only challenge I have. I was on a call when they had a committee with the mayor's office. They called me and I'd mentioned I'd like the seniors, but nothing happened. So if anybody know any private person that we're willing to give our proposal, give them the names. And I know some provider may probably give them free internet because I feel this is the new senior centers, because I don't think this is going to be a comeback no time soon. I think by 2023, this is my thing, not a doctor, things might get back for the seniors wanting to come out. But for now, they all want to get on the virtual centers.
Mrs. Macey, how many would you need, or how many would you want? Understanding that it would be limited, but what would be a good number to start with?
Okay, who am I speaking
Hi,
to?
sorry, Emily.
Okay, good. I know.
Can I just interject for one second and it's fine. Absolutely, we'll have the question answered. With every presentation we're going to have first the committee members are going to ask questions, and then we'll have members of the public ask a question. Really happy that you joined us, though. And because you asked the question, I think it's a fair question. Ms. Macey, do you want to go ahead and answer?
Yes, I love you, Emily. There's always a difference between a need and a want. And you did say how many I need or how many I want. If you ask me what want, I'll say 10,000 to cover every senior. If you ask my need specifically now with the seniors who really are dying to get on, I would say a minimum of 150. But if we get 50, we'll give those that make a raffle. So whatever it is, but what they need now is between 100, 150 for the need. And then we can raffle them. If it's a want, we'll give everybody, but 10,000. Thank you.
Thank you for that. Any other members of the committee have questions for Ms. Macey? There's a feature, I know that the process of asking questions in Webex ranges from the awkward to the impossible, but there is a feature where if you go to the top part of the participant screen, you can click on a little button that looks like a little hand and raise your hand. But feel free to type it in as well, or announce
Hello.
yourself for members of the committee.
Hi, Brandon. Can you hear me?
I can hear you, but I don't know who it is. I'm sorry.
This is Akosua Cobb.
Hey, Akoso. So happy to have you join us.
Oh, now
Good to see you. This is not a question for Ms. Macey. It's a statement. I just want the board to know that Fort Greene is an outstanding, it's a wonderful program. Of course, I'm biased. I talk about it all the time. But I just wanted the board to know that it's an outstanding and a very special program. It services a lot of seniors in Brooklyn, in the Brooklyn area. And I can testify if it wasn't there, it would be truly missed. And a lot of people may not have survived and may not survive, because this is a place where people come to socialize and they come to eat, and they come because they know that they are loved and welcome. And that is so important, particularly at this time when there's so many people that are feeling isolated. So again, I want to say thank you, Ms. Macey, for all that you do, and I will see you next week.
Thank you, Akosua.
Okay.
Brandon, it's Jessica. I have a quick question.
Go ahead.
Ms. Macey, thank you so much. Thank you for all of the honestly incredible work that you're doing. You mentioned before we were talking about the virtual sessions that you're hosting, you mentioned that you're doing wellness calls and checks on members of the community. Are there, I was going to ask, are there trends that you're hearing, but I hope you're hearing, but are there issues that you are referring to other agencies, or is there any support you need with that? I'm curious what is coming up and what you do with that information that you hear about.
Okay, Jessica, we were all frozen. At least I was frozen, so I didn't hear everything you said.
Okay.
Yeah. So can you repeat the last part, because you got cut off? You were frozen for a while.
Yes, I'm sorry about that. So when you're making these wellness calls that you mentioned, are there issues that you're hearing that you're needing to lean on other city agencies for, or is there support that you need that is difficult to get? I'm curious what's coming up in those wellness calls.
Okay, that's a great question. So what happens, Department for the Aging has a guideline, and they also have a lot of support and numbers we can refer people to, or we call for them if they cannot. So that's a very helpful thing. Department for the Aging has a lot of programs. And so my staff was trained if they have, for instance, somebody, you can tell they want to commit suicide and you're not a social worker. Of course, we train them a little, then they can reach out to their supervisor immediately. And there's a number for them to call for DIFTA right away. If somebody we call and they say they had no food. So there is support. And the wellness call is an addition to the virtual centers. We still make wellness call every day. And whoever is not on is not neglected because they get the wellness call. Lately, people that don't get wellness call is because they're coming out in the street now and they're not home. They're not staying home. Because I cannot imagine and understand how they feel. In the cooling center, like the commissioner came and saw, and I heard she mentioned in a meeting we had the other day, the chief feel at this time, they're not only coming for cool, they're coming to see their friends. Even if they can't touch them, they're 6 feet apart and they're talking. And I think, so it's really a challenge. And I'm praying that they work it out so they can come back. We can have 2 sessions or whatever to make it social distancing, but they want to see each other's face. So we're hoping that will work out.
Oh, thank you.
Thank you so much.
You're welcome.
I'm going to ask the rest of the committee members to, if you have any questions, to definitely feel free to share them. I just wanted to give one sort of public service statement here to the members of the committee. If you are speaking, if you could please turn on your video, just so that we can comply with the open meeting laws. We're trying our best we can to work in the virtual environment, but it's a requirement and important for everyone to be able to show their lovely faces here. So if you could please do that, that would be great. With that, were there any other questions from members of the committee for Ms. Macey?
I'm sending my email now, and Ms. Church has it. So
I think I heard somebody has a question, Ms. Macey.
Ms. Lois, you raise your hand.
Oh, so I think I'm going to ask Mr. Varela to ask his question in just a second. But for anyone else who's not on mute, if you could go on mute, that would be great, because I think we have some background noise. Whenever you're ready, Mr. Varela.
Can you hear me?
Yes, we can.
Yeah, okay, great. Sorry, I'm having a lot of connection issues here. Thank you, Ms. Macey, for your presentation. And first off, my condolences for all the loss you mentioned earlier. I had a question just in general, if you're noticing any trends in evictions, if anybody's reporting more evictions.
Very good question, too. It's a lot going on. Thankfully, we are really supporting our seniors. And as of today, that's one of the questions we're asking too. There is no one getting evicted, and nobody's in that, nobody had to withhold their rent for the pandemic.
Thank you.
You're welcome.
That's good to know. Were there any other questions from the members of the committee? Okay. I think I'm not hearing any more questions from the committee. Any of our members of the public who've come, I don't know if it looks like we have a notice in the chat now that we're open for public comment. If you can raise your hand, if you have a question, we'll be happy to ask Ms. Macey.
No, I just want to thank you for having me. I know I have another meeting. Actually, Carlton bent my hands to change my meeting to later. So I'm happy to be here. And in the world of Zoom and video, it's difficult more than I'm like doing 2 things, and I'm still in the office, so I have to join another meeting. So thank you for having me. I just sent my email, and I put it to Fort Greene Council. I put my personal email. So if anyone has any other questions, you can email me. I will reply to you. And if anyone has any backup when you sleep and wake up about the laptops or anything, just shoot me an email. I'll be happy about that.
Wonderful. Thank you so much for your presentation.
Thank
really happy
you.
to have you. Thank you for your time.
Thank you. Welcome.
Excellent. Moving along to the next step on our agenda tonight, we are due to have a presentation from Christina Reintom on behalf of Brooklyn Community Services. Do we have Christina here? Okay, I'm not hearing or seeing Christina here.
There is a participant named Christina on the call, and I believe she's muted. Christina, would you like to speak?
I'm Christina Cordero, not Reinhardt.
Oh, okay.
Okay.
Well, we're happy to have you all the same. Thank you for coming. We'll be happy to get to you at the point where you speak. Thanks for joining.
Okay.
Ms. Church, perhaps you could see if we can make contact with Miss Reintom. Is that possible?
I don't have any other contact information beyond an email. So
Okay.
I do not know if they're on. I doubt it.
Well, they don't seem to be in the room, so I think we should probably move ahead to the next point in the agenda, which is a discussion of our district needs statement and budget priorities. I think it's great that we've gotten to this point here because the district needs is really coming up in what is it, October? We're due on district needs, and it's going to be pretty important, particularly in light of presentations that we've heard in the last meetings, whether it be the maternal mortality, whether it be the presentation that we heard about the Brooklyn Plaza in the last meeting, and then today from the senior council. There's a lot of stuff that's going on in our community that we can speak about and work on with our district needs statement, and I think it'll be great to have everybody's input on that. Did everybody get a chance to see the spreadsheet that we circulated around and the draft? And I think Alejandro added some comments to it. I don't know, it's kind of hard to take a poll on the Webex call, but I thought that there were some interesting points in there about like mental health and NYCHA. Alejandro, do you want to maybe mention a few things about that so we can sort of get the discussion kicked off?
Sure. I'll make it quick and hold on. I've just pulled it up. So I just put some items that came up in a CB2 email about a meeting that was had last week around what CB2 can do to do something about the social and racial inequities that have been brought to light or that have gotten attention recently. And is there something more that CB2 can do? And so, I mean, if it were up to me, we would just focus on reparations, but that's another conversation. So what I mentioned was that we had, there's a strong effect from, sort of a lifetime of racism and discrimination, and people are walking around with that trauma. And so I think there's stuff that can be done from a health perspective around mental health and providing access to more care in our community. I suggested mobile health clinics because they have a long history. And so we could have more mobile health clinics that provide counseling and care for trauma and stress. And I put it both ways, not just for people who are survivors and dealing with discrimination, but also for people who are perpetrators of racism and discrimination to prevent the sort of dangerous situations that are happening all the time. So to combat sort of ignorance and insecurities. So that was one thing, mobile health clinics. The other thing that I put out there was the local hiring. I mean, I didn't know how to frame this in a way that would be an actionable item, but I bring this up pretty regularly. There's need and there are opportunities, and they're not meeting up in CB2. In this committee alone with liquor licenses, we see hundreds of jobs every year, and we're always encouraging people to hire locally, specifically to hire Black and brown people. And then I go to these bars and restaurants throughout the year, and I don't see any Black or brown people working there, or even eating there, to be honest. And so what can we do? I don't know what happens in the interim between the time that all of these business owners say, yes, Alejandro, yes, we're going to do it. Yes, we're going to hire locally. And we give them contact information to Fort Greene SNAP, to the Ingersoll Community Center to Post, to the Brooklyn Navy Yard, but then something isn't happening. So I think we're well positioned because we know so much about what's happening in CB2, and we have interaction both with the people who need jobs and the people who are providing jobs. Why can't we do more to make those connections happen? And I think I don't know what that would look like, and I put an example there. So that was the other. And then the article that came up through Vice that Carol Ann sent around evictions and how we're finding that it's disproportionately landlords are evicting Black women as compared to white women. And so what can we do from a CB2 position to monitor evictions in our district? How are they happening? Who are they happening to? Anyway, so those are the items that I put up there.
Thank you for that. No, I think that those are all really interesting items. I mean, each one of them is an issue that really thoroughly could be unpacked and really needs a significant amount of attention and investment. I think from the conversation that we had a couple, I think it was about 2 weeks ago, there was definitely, I think the conversation was very much at a high level and wasn't really as focused on district needs as it was on really everyone's thoughts and reaction to the events of the last few months and how it's impacted them, and we didn't really get down to the nitty gritty of of penciling out 1 or 2 or 3 district needs. But I think that this is what you've been able to come up with here is a step in the right direction on some of these items, and hopefully there's a way we can craft this into some additional needs. The things that I think about are, I mean, certainly there's issues of equity, and I think the NYCHA survey that you suggested was an interesting idea. Just speaking to Samantha Johnson today about something else, and she mentioned that they have this scaffolding up in the NYCHA development for that she lives in that has not been taken down for something like 10 years, which is somewhat of a concern, because it not only causes confusion for people trying to visit the developments, but it disturbs the quality of life of the people who are at the developments. I thought that was an interesting comment and possibly something that we could fashion into an additional need. I'm really curious and interested to get more of a voice from the NYCHA community into the statement of district needs, so that we can try to see ways we can take something either into a budget item or a expense, and try to make life in the NYCHA developments more equitable, more healthy, and also more beautiful, along with the rest of our community, with appropriate upkeep and facilities. I think also the COVID pandemic has produced a situation where we saw with Brooklyn Plaza, they clearly did not have sufficient resources when they first got hit with the pandemic to treat people for common symptoms, to be apprised of the right medical next steps, to be given the right equipment. And I think somewhere on our needs, there has to be sort of comprehensive distribution and facilitation of the personal protective equipment getting out to both hospitals, medical providers, as well as places where there are large concentrations of people, like NYCHA developments, so that people have the opportunity to use them. And I'm continuously troubled by the number of people who just flagrantly don't wear masks left and right throughout our community, in multiple different settings. And it's always a struggle to balance people's individual rights to do what they want with the public health effects that come out of not wearing masks, but it's particularly noticeable to me that, you know, we have all of these businesses that are serving alcohol on the sidewalk or serving food on the sidewalk even. And every time I go by these places in our community, there are very few people at the tables wearing a mask, and I am concerned about the health aspects that come out of that. I don't know. I've done a fair amount of talking. Does anybody else have any strong thoughts on some of these things?
Just one more thing to add that I'm not exactly sure how it should show up, but you know, I always talk about green infrastructure, and it can seem a little bit intangible or maybe not always timely, but particularly with the development that we still struggle to have a voice in controlling. And while we have other committees that are thinking about how we address things like AMI calculations and the lack of affordable housing in the district, I worry a lot about air quality and street safety. I know that's a little bit of our overlap with the transportation committee, but particularly like around like Atlantic Avenue and around like 80 where 80 Flatbush will be, like all of this congestion will really continue to compromise air quality that is not just about new people moving into this district, but longtime residents in this district. And again, I don't really know what form that takes, but I do think that air quality and other sort of lack of green infrastructure issues that have persisted kind of contribute to this inequitable, I don't know, infrastructure of the district. So I'm going to keep thinking on what that actually starts to look like. And I don't know that I think we should recommend things like testing explicitly. I don't know that we could really have that power. That's really a question. But I do think that some of the effects of this out of control development are felt disproportionately by the same parts of our district where there's also a lot of long-term unemployment, and it's just sort of a compounding issue.
Yeah, I think that's a really salient point, and certainly the extent of development that we have, there has to be a consideration of the environmental impact of it. Does anybody else want to weigh in with anything on their mind?
Non-community or self-community.
I think I heard somebody somewhere.
Yeah, I just wasn't sure if it's still community time.
Oh yes, no, just like anything else, Emily. I appreciate you getting involved, but I'll give you a chance. I will. And I think it's great that you're wanting to ask a question or be involved. Now, I'd love to get your input as a member of the community too. So I got a note that Mr. Newmark has a question. Mr. Newmark, the floor is yours.
Thank you, Brandon. I wanted to, first of all, I wanted to say I agree with everything Alejandro raised, as usual. I usually agree with him. I think those are all very important for us to consider and try to develop into need statements and hopefully related budgetary requests. And I think Jessica's thinking is really big picture in terms of that as a problem. And I think we will need to think that through some more to see if it's possible to turn it into anything that's actionable in any way. But I think, you know, it's a very key point. When you look at the child asthma rates in our district compared to other parts of the city, it's really horrendous that kids are suffering and families are suffering the way they are. And that leads me to something I wanted to say, which is not really a specific need statement at this point, because I think we really covered a lot of good ground last year also in the major needs that are there. I don't think want us to rewrite something that's good and that's accurate and that's true. But what I wanted to point out is that we are a very diverse community district, which probably everybody here knows, and I'm saying what everybody already understands. But I don't know how needs are thought about on the city hall level. If they look at community district wide, we look like a wealthy community district. based on the last numbers that are on the front page of our community board statement, 61% of us have a bachelor's degree or more. Only 31% spend 35% or more on rent. Only 31%. That's much lower than the rest of Brooklyn and New York City. 99% of us are supposedly near parks within acceptable walking distance, which is way above what the city's target is. 11% are at the poverty level or below, compared to 21% for Brooklyn and 20% for New York City. So my point, I guess, is that what the people who are going to make the decisions about spending money and focusing on issues need to understand is that we're a district that have pockets of tremendous need and tremendously long histories of having been ignored. Now, I guess that fits right into what you were talking about earlier in terms of inequity. And I guess I'm just trying to illustrate that a little bit with numbers that we can't talk district-wide. Brooklyn Heights, where I live, Dumbo Heights, where I guess I actually live in, Dumbo, Cobble Hill, Carroll Gardens, Park Slope, well, not Park Slope, but, what my neighbors need is very different and at a different level than what many components of the district need. And I think that has to be repeated frequently so that the powers that be who are going to really make the decisions about spending money understand what it is that we're asking for. Because if you ask for something and they just look at these broad numbers, they think you're nuts. So that's my statement for now.
That's a fair point. Alejandro, you had something you wanted to add?
Yeah, sorry, I don't want to dominate too much. Thank you, Barry. Mutual Admiration Society for sure. I completely agree with everything you said, and I would like to say that part of the problem is how the data that we're getting, that community survey, which it really murkies up the waters here, exactly for the reasons you said. But then you look at census tract data, and we have two of the poorest census tracts in New York City, right? And so we need to push for the data to get more specific, to get grainier. It would be right. So that I think that's really essential that we push on that level to get that data. And it's there. It just needs to be teased out and presented to us in a way, because the community surveys really it pulls everything too much together. Just going back to the NYCHA conversation before, and I don't want to make this all about NYCHA, but at the best of times when we're at 3.5% unemployment and everyone's excited and saying New York City and the country's great, NYCHA is at 22% unemployment, right? So it seems that there's an acceptable level of misery always that we don't make a big deal about, and right now during the pandemic, I can't imagine it's probably nearer to 40 or 50%, right? And so we need to get that information, and that needs to be front and center, because when you say 22%, to ignore that is criminal, right? We're already saying we're okay with 3 to 4%, right, as a society, but when you say 22% and we're ignoring it, it's pretty bad.
Yeah, absolutely. Do you think that maybe there's a district need in and of itself to sort of reform the community survey process and focus it more on identifying pockets of need within each community rather than just making blanket statements about the community as a big picture? Okay, I got your support on that. That's good. Carol Ann, is that within the bounds of something that we could put down as a district need? Okay. I think you're on mute, Carol Ann.
Carol Ann, you have to unmute.
After I made that very eloquent speech.
Yes. Yes.
I was saying in terms of us pulling out the data of the census tracts, yeah, we can do that and focus a lot of our statement on that. I don't know that we can actually impact the American Community Survey. But the community health profile also actually gives a little more detail, I think, than the broad census data for our district, the one that New York City does every year. And so that's something we can use, as well as most of the city's data is accessible online. So if we have, you know, a lot of data people, that's something we can actually get into and tease out the data that we're looking for.
Okay, I think that, I mean, I think we'd be very interested in that. I have in my mind, you know, should we be asking the city to focus their citywide survey on something that's more focused on the more needed areas of our community, rather than like the, you know, the community district as a whole? I mean, or is that too wonky of a district need?
No, it isn't. But again, on the health, the community health profile sort of pulls a little bit of that out. It will compare like Brooklyn Heights with, you know, Fort Greene, or a little smaller. So some of that data is actually somewhat available.
Yeah, I got it. I think I got it. But I think what I'm hearing, at least from Barry and Alejandro, is that we need to have a little bit more geared towards those specific aspects of the community district, because, you know, in some parts of the district things are going fine, and it's not worth really. I mean, it's good to know that we have that in our community, and those of us who are lucky to live in that circumstance can be gratified with that. But really, like the focus, and maybe even most of the report should be on areas where improvement can be made. But I think
we can make a request that they do something for us. Yeah.
Okay. I feel like there needs to be more. I think there needs to be more education on COVID-19 put out to by the City Department of Health. I'm actually not particularly aware of the extent of work that they've done. I've tried looking at their website, and they seem to have information there about, like, you know, common sense things to do and things to know about, like the childhood Kawasaki syndrome and such like that. But I'm really not aware of any major initiatives, and it just makes me feel like in the world that I see with the COVID-19, where, you know, 50-50 people are not wearing masks when I go out on the street sometimes, that, you know, there needs to be more education provided, particularly to, like, small business owners in the city. And you know, we've had a very kind of interesting couple of months with all kinds of things going on. And I know even here locally, there have been a few bars and restaurants who've had their liquor licenses taken away because they're serving people without wearing masks on the inside. And I just feel like that could be, that there's more education that's needed, you know, and not like mandating people to wear the masks, but really making sure people understand the importance of it and the risks. That's my point, at least.
And what is our next step with this? Can you just remind me, maybe others?
So I think we need to sort of catalog out what we feel are sort of new critical needs, and we should probably have a review of the existing needs that have been in place from years past. I know that some of these things have come up and have been retired and or fulfilled, and others may still persist. Carol Ann, where do you think we can find the most recent catalog of what we've done in years past?
I can send a link. It's on the city planning website. I can send a link with the last two statements.
Okay.
Is that what you mean?
Yeah. absolutely. And I think like what would be a really good takeaway is if each of us can think about the things that we talked about here. You know, Alejandro's done his part with his thing. I'm going to put something on there about the COVID-19. Jessica, maybe you can throw something on there about the environmental issue. We have this commonly shared spreadsheet where we can log on these items, and I think we need to record what we feel are important priorities, and then we'll have to have an opportunity to make comments about anything that is currently pending. Do we have time to come back on this in September, Carol Ann, or do we need to make our comments offline?
September, we have enough time to come in September, but we need to be looking towards making some definitive decisions because the statement is due the end of October. So in October, we need to be able to vote on the things that we've decided, as well as the priority listed. And one more thing is that we need to think while we consider all these ideas, what is now our health priority? What do we see as the overarching health priority for the district?
Right. I mean, certainly there are a number of things that we can cite, but you know, we've got COVID-19, and I'm wondering like what role that should play in that. I can't see if anyone has a question. I don't know if Alejandro, you had a question.
I do. Yeah, sorry. I just want to say a couple of things real quick. One is that will someone come back to us? Maybe Carol Ann, after you've seen the spreadsheet, if it doesn't fit the parameters of how the information or the points need to be put into the document, will you come back for clarification or let us know if you need any tidying up? Number two, I tried just now to add a quick summary of what we talked about along the collecting data at a more sort of a smaller geographical unit, but I didn't do well with the parameters. So if anyone wants to add like which agency that would be and specifically where. And then lastly, I just wanted, as a reminder, I kind of have to jump off because I have another meeting to go to. I can stay on a bit longer because I realized we didn't really get through this part. And I might end up breaking quorum, right, if I leave because I'm the fifth person.
Oh no, I don't believe you are. We've been joined by Ms. Cobb, who I believe is
okay, great,
the fifth person. So I think you're okay. Although we'd love to have you for as much time as you wanted to give us.
And also, I just want to say to Nicole McKnight, welcome aboard. I know this is sort of an unorthodox way to join the committee, and I'm thinking back to when I started, like 11 years ago, and I didn't know when and where to jump in because it was all moving very quickly and fast, and there's a lot of sort of historical stuff. But I want you to know that if you feel free to just jump in and ask questions if this is all moving too quickly, and we'll stop to explain or anything. I don't want to assume where you're coming from with this particular conversation or with your history with CB2. So,
Alejandra, I appreciate that. Thank you. And I'm just taking it all in. And the thought that came to mind when you were mentioning about the health disparities, I was thinking about the issue of getting access and ensuring that people actually have health insurance, but once they have it, having the access, because mental health services, it has been an issue in communities for Black and Brown people because we really don't have access to it. So those are the thoughts that came to mind as you were speaking.
Thank you for sharing that, Nicole. I think that that's definitely something that we're going to need to capture in the spreadsheet and in our district needs, because it's clearly one of our top priorities, and it's one of our top priorities year in, year out. Some of these things like mental health services and child asthma, I know are things that we have been talking about year upon year, trying to find ways to improve. And I think healthcare access. And if you have ideas for concrete things that the city can do in the form of services or in the form of capital expenditures, I think like Alejandro has a great idea about these about mental health vans going out in the community. That would be a capital expenditure because you got city would have to set aside resources and purchase a vehicle, I guess, to do that. Then log these on the spreadsheet. I hope you have access to this that we shared via email. I'll try and make sure everybody has a renewed link to that afterwards. And we can have some input. Did any other members of the committee have any more points regarding district needs? Not hearing anything else from the committee. Like with anything else, I'm going to ask the community if you have any other points that you'd like to make that are just very strong needs. You can use the raise hand feature. So I'm not seeing any raised hands.
It's a feature.
Chair Smith, I see Emily, Onadu, and Latrell have their hands raised.
Oh, wonderful. I don't know why I can't see that, but thank you for letting me know. Let's see. Emily, I know you asked you were about to ask that before. Thank you for waiting. Did you have a point you wanted to make?
Yes, and I'm getting the hang of this. So two things. So just on Alejandro's point about the mental health services, there's actually, I don't know the exact details, but I can connect him with Fort Greene Park, because through the Fort Greene Park Conservancy, they've actually recently received grant money specifically around mental health. And so it just seems like as much as possible within some of the neighborhoods where there's work going on, there can obviously be some kind of joining of the effort. So Alejandro, not sure if you're aware of that, but this is very recent work that was being done that I heard about through Rosamond Fletcher. So I can get more details about that and connect through the official community board email address. Because again, I just think it's worth having a conversation, but specifically just around the issues of mental health. And then to Barry's point about the data, I'm a total data nerd. And so one of the things that strikes me, because I was looking at the same thing you were, the chart that showed where it looks like we're doing a lot better than the actual, if you're in the neighborhoods you experience and feel. And one of the things is that obviously they're reporting the data as means, and means always erase kind of like the edges of the data. And so I think one thing that would be an interesting point to start is just to even get the actual range of the data so that you are seeing the lows and the highs, because I think particularly when I think about Fort Greene, the highs have gotten so high that it has thrown the average off considerably. So that I think there's this obviously getting more granular data as Alejandro is speaking to, but I think just even as a start, if there's can be some effort around getting the actual range of data.
I think that's a great point. And just for the sake of time, I want to also take Latrell's question. Latrell, I'm sorry we didn't get to you, but I'm happy to have you here. Feel free to introduce yourself too.
I'm Latrell Masso. I'm a community board member. I have 2 points. When you talk about Brooklyn Heights, Farragut Project is considered in that umbrella of Brooklyn Heights. So when you look at the big picture, you may see like Dumbo, Brooklyn Heights, and they may miss out on Farragut. And Farragut housing development is a need. That's my first point. And also with the recent virus, I believe the disability community population is going to increase. So we need to be prepared to have a larger number of people with disabilities is shown, because there's a lot of underlying health concerns with people, and going forward, more things are going to come out with people, the disabilities community, and it's going to be a higher number. So I think that's another important area to look into.
Thank you for that, Latrell. We will not forget about Farragut. We'll make sure that we address that. And if you have any specifics on the issues with Farragut, feel free to share them with me and or any of the other folks from the committee. But feel free to I'll drop you my email short afterwards, and I'll be happy to try to facilitate getting some of that information into our district needs statement. I think that, and certainly the disability issues are very much at the forefront for us. I want to make sure that if there are any specifics, and we should think about this in our approach, any specifics for increasing access for areas for folks with disabilities, any different kinds of disabilities that might exist, whatever it may be, physical or mental or what have you. We should try to find a way to put something about that in the district needs statement. Okay, I don't, first of all, I can't tell when people are raising their hands, so I'm going to assume that nobody else has. Oh, I think I have one more thing from Barry. Barry, I'll give you one more question, but this will be the last one because I'm going to move the program along a little bit.
Yeah, and I wasn't sure where this would really fit, but I just was reminded. Filling out the census is very important. And we need to have a concerted effort, which I haven't really seen, that's Brooklyn-wide, about our filling out the census. And Brooklyn is very far behind. So that effect for many years to come on those components of the community that are in the most need for the kind of response that the census could potentially offer if the numbers are accurate. So somehow we need to do a better job of helping people know how important the census is and helping them to answer it.
Thank you, Barry. And anybody else have any other thoughts on district needs before we move on? All right. Moving on to the next part of our agenda. We've got our liquor license review for the month. We have 3 liquor licenses up today. They are all full on-premise liquor licenses. The first one is 264 Carlton Avenue, Los Dos Hermanos. Do we have someone here from that location?
Yes, good evening, everybody. My name is Anthony Caraballo, and I represent 266 Carlton. That's the actual address. And the name of the entity is Los Dos Hermanos. And I'm joined by the applicant's son, Oscar Rodriguez, who will be managing the premises. The applicant is Rosie Rodriguez, who owns the building and also owns the adjacent liquor store.
Okay, thanks for joining. Now, I believe that we've gotten a copy of the application, and I just want to check with the members of the committee. Has everyone on the committee gotten a copy of the application?
No.
Okay. All right. I'm just going to quickly share the application around. Okay, I think I got it. To everybody who's here. Okay, I hope everybody on the committee's gotten a copy of the application. I did just forward it to
No.
you.
Brandon, you're saying it's in everyone's email, right?
Yep,
Okay.
should be. And I think we've been joined by Mr. Harrison.
Excuse me, Brandon?
Yes.
We can actually share the application itself on screen.
Okay.
Sorry about that. Anthony, are you ready to do it or should I?
I think you should do it, Caroline. I was trying to do it earlier and I was having some difficulty. So if you could do
Oh,
it, I'd
because
greatly appreciate it.
you're not enabled.
If you're able to do it, that'd probably be the better option.
We are enabling for all of the presenters. We're enabling you at your point of presentation. So that's why.
Mr. Caraballo, you've been given presenter privileges, so if you'd like, you can just go ahead and choose share screen from the upper left.
Yeah, so I'm on this and I'm on the share content and I have a file, but I don't know how to get it to you guys.
If you go to the upper left inside of Webex and click on share,
yep,
and choose share content, then choose the window that has the content open.
Okay. I don't know if that worked. Did that work?
No, it didn't. Tyler, are you or Caroline? Could you go ahead and share it, like on the community board account? Just really interesting.
Yep. Carolyn, do you have it open? I don't have a copy.
Yeah, I have it.
Okay, I'm making you the presenter then.
You need to, yeah.
Shush yourself and you still don't know what you're doing.
Oh, sorry, I can't see which is which here.
Yep, I see it.
Okay, that's great. We can see it. Thank you.
Excellent. Yep. Okay. Mr. Caraballo, you can go ahead with your presentation.
Essentially an application for an on-premises liquor license. Again, the address is 266 Carlton Avenue. That's Carlton and DeKalb. The other cross street is Willoughby. The owner is Rosie Rodriguez. She owns the adjacent liquor store, as I indicated earlier. She's owned this building for over 3 decades. She's entrenched in the community. This is the old space that was a Smooch Cafe. They were there since 2005, more or less. They recently closed down. It's a relatively small premises. There's seating for 20 inside, 6 tables with 14 seats, a small bar with another 6. And then there's an outside area that Smooch also utilized in their years there. And it's actually part of the building property, the building envelope. So a DCA sidewalk cafe permit is not required in this instance. And out there, the proposed seating is 5 tables with 10 seats. The hours of operation are from noon to midnight, 7 days. So the establishment will be closing relatively early. The applicants have no interest in having a late night bar. They own the building, they own the liquor store. Additionally, the menu will be comprised of tapas, salads, and tacos. And they'll basically employ upwards to 5 people. Oscar can confirm this in that area. And we would address any questions that the committee might have. There's also 4 letters of support, to my understanding, that were sent in for this application.
Thank you, Mr. Caraballo. I appreciate the presentation, the elements background that you've given. I understand, and we received a rather sizable number of letters regarding this particular application. We did receive some letters of support, but they seem to have been outnumbered by a fairly sizable number of letters expressing opposition to the liquor license. And I'm not going to go into the deep specifics of any of the letters, but I think aside from the concern about the noise that would be generated by any outdoor cafe in a residential neighborhood, which is something that I feel is fairly a common concern that we express. There were some concerns expressed in the letters about the liquor store that the applicant currently operates, and specifically sort of indicating that the applicant was serving or providing an opportunity to have, as it was alleged, kind of an illegal sidewalk cafe where where folks who had purchased liquor at the liquor store would then go out and drink the liquor on the street. And I guess there have been some concerns in this community about the level of noise that was generated from these experiences. And I think there were even some photos that were shared with us with expressing concerns about the amount of noise, as well as the fact that some of the staff members at this liquor store were not wearing masks or complying with the COVID-19 health directives. So I think I may not have fully encapsulated all the concerns that were expressed in the letters, but I think that was definitely many of them. And I would want to ask the question first, like with any application like this, what is the degree of involvement and outreach that has taken place to date with the Block Association, the folks in the local community? Do we have signatures that are part of this application? What's the relationship with the upstairs and surrounding neighbors? And is there really a feeling that the folks who are around this area are supportive? And if not, what does the applicant plan to do to address any concerns?
Great, Brandon. So firstly, I had a meeting with Ms. Rodriguez and her son Oscar actually today in preparation of tonight's meeting. And I had discussed these issues prior with the community board. And outside of the liquor store, there is a table, to my understanding, and some chairs. And then the adjacent commercial property, there's 2 benches. So pursuant to my client's information provided to me, basically this is for members of the building, like for personal use, and this is for their use. So when I indicated to them that there was an issue with this, these were immediately removed. So there's no longer any seating in front of the liquor store, which again I believe upon information and belief was 1 table with 2 chairs, and then there were the 2 benches on the adjacent storefront, which is vacant at this time. So I would that will cease immediately in terms of having any seating out there. I believe maybe there's the tenants or people in the community might have utilized that seating. It's my belief that the liquor store wasn't promoting this, that they're not promoting people buying liquor in the store and then going right outside and drinking. This certainly is an SLA violation. The liquor store has no SLA violations. Also, in terms of the noise that might be generated, and we're at the particular premises, because basically the outdoor seating proposes to cease at midnight when the operation closes. There already was outdoor seating at Smooch Cafe for many years. And in terms of music, there's background music only. So it's a small place inside. Again, seating capacity inside is 20, outside is 10, 5 tables, 5 2-tops, and that will close fairly early. And all those complaints, we've listened to them, that seating was removed immediately. I mean, the last thing the applicant, wants to be is a nuisance to the community. She's been there for over 3 decades. She's entrenched in this community. She's a property owner. She owns a liquor store. She certainly doesn't want to be a nuisance. The ante is increased in a sense because they own the property also. They're not transient tenants. So they do own the property, and they have a vested interest in the community. In terms of the outreach, the second component of your question, we provided the 4 letters of support but pursuant to our meeting today, we can certainly get petition signatures for you, and we can certainly additionally reach out to any block associations for additional support.
Okay. I'm going to let other members of the committee ask questions as well too. Does any other member of the committee wish to ask a question?
Yes, this is Jessica. I just wanted to reiterate, I'm not sure I heard an answer to Mr. Smith's question that are there tenants in the building? And if so, have you met with them about this application?
So Oscar, I'll defer to you on this. There are tenants in the building. Oscar, if you want to jump in and answer that question.
Mr. Rodriguez, you need to unmute your microphone, please.
Can you hear me now?
Yes.
Okay. The building is currently 6 residential apartment buildings and 3 commercial dwellings. As it turns out, due to this pandemic, we have lost 3 residential tenants who have currently moved out and 2 commercial tenants. So that is the reason why we are taking the property and trying to do something with it as opposed to being vacant.
To be clear, have you engaged with any of the tenants that live in the building still?
Say again?
Are there still residential tenants in the building?
Yes, correct.
Have you engaged with them about this application?
Yes,
And what was their feedback?
they're all in support of us opening the business.
Did you provide signatures to that effect?
I didn't think I needed them at this point.
Yeah, we don't have signatures, Jessica, but again, as I indicated, we can certainly get a petition and we could certainly provide signatures of support. You know, what I would reiterate to the committee is that this premises was already licensed for a decade and a half. So we're not adding another license to the community. And again, and it's a fairly small establishment, and the applicant owns the building. So the last thing the applicant would want to do is operate a premises that would be a nuisance to the place where they own, and also have another liquor license in the liquor store.
Also, excuse me, to the members of the committee, the district office suspended the collection of signatures at this time. Applicants are welcome to provide them, but we're not asking for that.
Thank you, Karen.
Because of the pandemic.
I have, I don't mean to interrupt, Jessica, if you're still,
I'll go ahead.
okay. I have a couple of questions, Brandon, would that be okay?
Sure.
Okay, thank you. I guess I'm going to address it to Mr. Rodriguez, but I'm sure Mr. Caraballo, you'll step in as you see fit. My first question is, the liquor store proprietors and staff had no knowledge of people buying liquor and sitting outside their store and drinking it?
Oscar, I think that question is directed to you.
Obviously, our customers come into the store and purchase the liquor. Once they leave, we have no control of what the community does outside the public realm.
That's not what I asked you, sir. Please, what I asked you is, did you have knowledge of customers sitting outside the liquor store and opening up the purchases and drinking from them? That's what I asked you. Yes or no?
Well, from our establishment or across the street, because we have overflow from Miss Otters that actually comes over and sits down on the benches.
Okay, so you're not going to answer that question. I hope that's noted to participants. My next question is, would you consider closing the establishment Sunday through Thursday evenings earlier than midnight, since there are families with children who need to go to sleep at a reasonable hour, and a lot of the neighbors face directly onto the property that you are seeking to get a liquor license for?
So Barry, I'm going to jump into that. Good evening, Barry. How are you?
I'm fine. How are you, Anthony?
Doing well. Thank you, sir. So I think the midnight is a fair closing time. I mean, as you guys know, generally, you know, bars and nightclubs and establishments of that nature stay open significantly later. I know you guys as of last year or so, are really on new establishments want a 2 a.m. closing. And we're not even anywhere near that. I mean, we're at midnight. And I would bear in mind that the premises is small also. So I think our midnight is extremely fair. That's what
So
I would.
the answer is no.
No,
right?
the answer is not no, Barry. The answer is not no. This is a give and take. We want to work with you guys. You know, I just think if we could pull
So
some
what
other.
would your compromise be if you want to work with us, Mr. Caraballo?
The compromise would be we'd certainly be willing to close the outside seating area earlier than indicated.
That's
That was
all I'm really concerned about.
that was a concern of the community. So we would be willing to close that area at 10. So we discussed that today, and Rosie and Oscar were certainly open to that. They had no issue with closing that at 10 o'clock.
Okay. I'm not sure if I think that's adequate, but I appreciate the movement in that direction. Thank you.
You're welcome.
Okay. For other members of the committee, are there any other questions for Mr. Caraballo or Mr. Rodriguez?
Mr. Chair, I have an observation.
Mr. Harrison, the floor is yours.
Thank you, sir. So I actually have to apologize to the committee. I actually love to get to the meeting on time. And the trains weren't exactly with me, but I experienced a lot of difficulty. I guess I'm just not as tech savvy in just, even though I pre-registered in getting this going. So I got Renwick, my partner, to help me sign on today. But I did read the material that Carol Ann sent in advance, and thank you for sending it, Carol Ann. I did note between the lines, so to speak, of the numerous, I'll just call them complaints. That may not be a fair assessment of the group, but of the issues raised in the letters received by the board office, not in support of this application, there seemed to be an underlining theme about how it's a family neighborhood and we don't want a lot of noise. And this happened with people not wearing masks was one issue. Another one, sitting outside and consuming liquor that came from the liquor store. Well, we've sort of discussed those questions, but what I found amazing in his response to either his presentation or response to some of our colleagues, Mr. Caraballo raised certain points about the history of closing times that have been allowed by this committee. There is also the fact that he mentioned that there was a history of there having been an establishment at this address. And then there is the fact that for some time, right against or adjacent to this address, on DeKalb, from Vanderbilt to, I guess, Carlton, perhaps a little further now, there has been at least more than one chair of the board has said, well, it's kind of a commercial strip where we have a lot of eating establishments, and we have allowed numerous of them, whether they were restaurants, whether they were bars that serve food, whether there was something else that was licensed, to take hold and flourish there because it's seen as a kind of a nightlife destination zone. And so at times in the past, this committee or its individual members or more than one member had been discouraged from being too hard or too harsh. And those of you who have been on the committee, jump right in and state when I'm misstating the facts. A lot of what was raised that I saw in those letters were presumptions of what might happen if this establishment were allowed to operate the way it was asking to do. And in the past, again, this committee has sort of taken a position, more than not always, but often, we can't predict what's going to happen in the future, and we can't, if you will, blackball or encourage the executive committee a letter of no support because what is perceived to perhaps future. Then again, there's the interesting of the fact that one of the plaintiffs one of the people that sent in a letter of, I don't know, a letter of complaint, a letter of issue, or a letter of no confidence against this, against this entity's application was someone who was a mover and a shaker in the neighborhood, who's very big at developing parts in the neighborhood. And some people have seen that development as a good thing, but in all instances, it has, I think, brought traffic and brought life and promoted businesses. And yet, when this establishment that's just trying to take hold is in that individual's backyard, he's not very much for it. So, interesting perspective in that regard. Thank you for letting me. Okay, Brandon.
You're welcome. Any other questions from members of the committee for Mr. Caraballo or Mr. Rodriguez? Not hearing any. Any questions from members of the public on this application?
Yes.
Theo, about how many questions do we have?
Am I able to make a statement, or is it only questions?
This would be, if the only thing that I would just ask for anybody making a statement or a question, just try to keep it somewhat brief, considering the hour, and direct your comments to the chair and to the committee, just because based upon how we do this when we're in person, we normally ask folks in the community to do that.
So I guess a couple of questions and statements. So I would challenge the idea that the owners are not aware of the amount of drinking that goes on premises, because their employees engage in it. They're given cups that come from inside that establishment. So I would challenge that information as just being patently false. I would also ask the question of, I hear that Rosie's name is being used a lot, but I would ask how much she is actually going to be involved in the business. I would also ask that for this supposedly being a community that cares about others, I would ask why those tenants are not there. And I would not leave it to just understanding that, oh, COVID caused it. I would ask what the relationship was with the landlords, and I'm very pro-business. But I would ask the committee to push on these issues and to push on the idea that the people who own the liquor store are not aware. I live around the corner. I have engaged in behavior there. I have been given cups. I have been given alcohol to drink outside. So I just, again, I want to push and say that it is patently false. If anyone who runs that establishment is claiming that they are unaware.
Thank you. I just want to also see if there are any other members of the community who have a question regarding this application as well too. I'll give the applicant an opportunity to respond. Ms. Cordero, thank you for waiting. And did you have a point you'd like to make?
Yeah, thank you for having me. I just want to make a point. I live right across from the address, and I was here when Smooch was here, and I had a lot of problems. Littering, noise. They would blast music late at night, and I'm concerned that it's a bar that's being requested to have a license in a residential neighborhood, and I think 12 o'clock is too late. I mean, people have to work, people have to go to school, and again, the noise. So I have a big concern that with the problems with Smooch, and there was no liquor, what the issues are going to be when there is liquor and what was happening on the corner. Thank you very much. Have a good evening.
Thank you, Ms. Cordero. Was there anyone else in the community who had a question? Going once, going twice. Okay. I'm not going to get into a back and forth between anyone, and it's hard to do that in the Webex world anyway, but Mr. Rodriguez and Mr. Caraballo, I just want to give you an opportunity to respond to the comments and questions that were raised by the members of the community.
Sure. Thank you, Brandon. So I think issues pertaining to the liquor store are extraneous to the application we have before you today. In the absence of substantial SLA violations, which aren't there, we're aware of what's been stated tonight, but we're before you for an application for a license at 266 Carlton. I think the application is fair. I think a midnight closing is very fair as the industry goes right now. That proves they're not a raucous bar. They don't want to be open to the late night. They only have background music. We've agreed, as I indicated to Barry, that we would close the outside seating even earlier. We've agreed to an earlier closing time. So we're willing to work with the community. I think there was a license there at this premises already. And I think, again, the nature of the establishment, that's small, closing at midnight, the outside seating closing at 10. I don't know how it can be portrayed as a bar that will disrupt the area, quite frankly. That would be my retort to some of the questions and issues that came up.
Okay, I think just to kind of leverage one of those points a little bit too, Mr. Rodriguez, you wanted to make a point also?
I wanted to comment. Occasionally, just about almost every single weekend, we do have tastings, and we do have vendors from SLA. They're aware, they have permitting to actually do tastings. They provide cups, and people do drink wine outside. Absolutely. But that's strictly, they have permits to do that through SLA. It's got nothing to do with us. As far as the vacant apartments, we do have vacant apartments and we do have vacant commercial dwellings, but that's all due to non-payment. I'm down over $50,000 in back rent, which I will never receive. And to Barry's point, absolutely, we are willing to compromise when it comes to, as far as the hours are concerned during the week. We don't have an issue with that. And I believe that was Christine that mentioned that, from like maybe Sunday to Thursday. We would be more than willing to compromise with that. Absolutely.
Okay. I think really both to Mr. Caraballo and to Mr. Rodriguez, I just wanted to follow up on one of the community members' questions. How much will there be on-premise management and oversight of both the indoor and outdoor, really the outdoor area surrounding both the liquor store and this restaurant? I was a little troubled that I didn't really get the feeling of a sense of responsibility for the outdoors, and I don't think anybody is going to say that as a property owner or as the owner of a store or a business that that you're responsible for everything that goes on outside your business. But I just do want to get a better sense as to the feeling about, one, how often is there going to be on-premise supervision of the outdoor area to make sure things don't get out of hand with customers being loud? Or this is a very residential neighborhood, and the only way that this works in residential neighborhoods, from our experience, is if there is really strong supervision. And I think also there was the question would naturally be raised, I guess, what will be done in the event that there's too much noise or there's excessive concerns being raised by the community. Oftentimes, we have these discussions after the applicant has already met with the block association, and I understand we're in COVID times, so things are somewhat challenging, but it's sort of difficult to get an understanding about what's going to happen in that regard, with the concerns that have been expressed.
Well, to your first topic on the supervision, my mother and I have currently moved into the building because there was four vacant apartments, so there'll be 100% supervision at all times here. I don't think that'll be an issue. And I think that we addressed the issue with the outside noise and the seating. There'll be no more outside seating. on the liquor store. So that's going to be completely, well, it's already eliminated. So I don't think that'll be an ongoing issue from this point on.
Okay, and I also just want to ask regarding the allegations that the folks who are employed at the liquor store are not wearing masks. Will there be an emphasis on wearing masks, and will masks be required for employees? And to what extent is that going to be part of the experience of this restaurant as we're in the state that we're in now?
Absolutely. Obviously, things have been more heightened than they were in the past. And we've been addressed already with that. My brother and I, and my mother have all addressed that. It's all been taken care of. Obviously, this business probably won't be opened up until the next 4 to 6 months. So then we'll address that when the time being.
Okay. And I just want to get a sense as to the hours that you're okay with. I think there was a discussion about Sunday to Thursday and closing early on those hours. And I think we discussed like 10 p.m., but is that indoor and outdoor, or is that just outdoor that you're willing to do that for? And what about on Friday and Saturday?
So, I mean, Oscar, you want to take that?
I will let you address that, Anthony.
Okay, so again, as I stated earlier, the outdoor seating will certainly close at 10 o'clock, 7 days a week. And the midnight, again, not to be repetitive, and I apologize, but the midnight is extremely fair. Midnight's usually the cutoff. A lot of community boards, and I believe you guys do that as well, have administrative approval for certain apps if they close at midnight. So midnight's like the threshold that you're really not going to be a raucous bar and you legitimately a restaurant or a cafe. So again, we think midnight is fair. I mean, if the committee thinks otherwise, we will listen to you right now. If you want to do a poll of committee members, but again, midnight is a fair closing hour, and reducing the outdoor seating by 2 hours, we've already worked with the committee in response to the concerns that the community has.
Okay. Would you be willing to do 10 o'clock, 7 days a week on the outside?
On the
Brandon, I
outside,
think you already
yes.
stated they would.
Yes, we stated that.
Okay.
That's done.
Okay.
No issue at all.
All right.
Brandon,
Now, we're going to need to wrap this up because we're nearing the what may be the close of our meeting, because some folks on our committee need to go. So I would just ask if I can probably take maybe one more question from the committee. I see Mr. Harrison, you're interested in asking a question. If you could just make a brief point, please.
I just wanted to follow up to a question you had and the applicant's response. What I heard him say is, by saying, oh, it's going to be addressed, is, and Anthony or the applicant, I'm sorry, whose name I've forgotten, it's a closed-end question. So regarding the issue of masks, they will be worn, correct?
Yes.
Thank you. Brief enough?
Okay, great. And ask the members of the committee, do we have a motion on this application?
I'd like to just ask one more brief question before we vote, and then I'd be happy to make them. Mr. Caraballo and Mr. Rodriguez, I appreciate your attention and your consideration to the community's concerns. Can you assure us that once, hopefully, God willing, you're able to open and you're successful, do you agree that if the community has concerns and questions and brings them to your attention, you will be open to discussing the concerns of the community and knowing that that will be also put before this committee, I'm sure, by your community members? So can you assure us that will be the case and that will be a good relationship back and forth?
I'll be willing to provide everyone my personal cell number, email address, anytime, and address any issues you may have.
Thank you very much. I appreciate that response.
Does anyone on the committee wish to make a motion?
Yes, Mr. Chairman, I move to approve.
Second.
Okay, second from Ms. Thurston. Discussion on the motion?
Yeah, I have a point of discussion. I just want to share that I think I really appreciate, Mr. Rodriguez, that you said you would be amenable to sharing your cell phone number and having that conversation when people come to you. I just have to say that when we receive this level of pushback from the community, we're here to listen to that. And I'm really concerned about what I've heard and the lack of ownership over what has happened. So I will be voting opposition.
All right, any other discussion on the motion? Or more discussion? Okay, so we unfortunately have to go by each person because it's Webex. Ms. Cobb? How do you vote? You on mute, Ms. Cobb?
Brandon? Can you hear me?
Yes.
Okay, all right. Approve.
Okay. Mr. Newmark?
Jessica's, I don't know if I'm, no, Jessica's point about community concern is of grave concern to me as well, and obviously by my questions. But John's point about giving people who are offering to be reasonable a reasonable chance, an opportunity to prove their mettle, resonates for me as well. So I am surprising myself to say that I'll vote in favor of their getting our recommendation for a liquor license.
Okay. Who's next? Ms. Thurston? Mr. Harrison?
Yes.
I think we have anybody else.
I think that's everyone.
No, it's not me. I vote no.
Fail.
Excuse me, did Nicole vote?
No, I didn't.
Oh, Ms. Knight.
Oh, Ms. McKnight, I'm sorry. I'm sorry.
I vote yes.
Okay. So what's our outcome?
I think it was 4 yes, 2 no.
Okay.
I'm sorry, Jessica, did you say?
Motion is a. Thank you all very much for your time.
Great. Thank you so much, everybody. Have a great evening. Stay safe and be well. Thank you, guys.
Thank you very much.
Next up, we have 78 Rockwell Place, Project Noir. Do we have someone here from that location?
Yes. Hey, can you please unmute Eleanor Mooney?
Hi, I'm also from Project Noir. My name is Sam.
Hi.
Right. Do we have a way to present, and maybe in the meantime you can start giving your presentation?
Yes, I can actually start that. Again, my name is Sam. I am the owner of Coffee Project New York on 78 Rockwell Place. This is the original location for a cafe spot, and we've been here for about 2 years now. We have multiple locations around the city, and this is closer to where we're living. And we met Eleanor and Chris like maybe about a year ago, and we have been doing a lot of like community event for coffee community. So our space is vacant at night. So one day when the both of them join us during a community event, they are like, the space is beautiful. And since we've been offering a spot for the coffee people in the morning, and we're feeling like maybe at night we can open up our spot also for more like a speakeasy doing a little bit of cocktail using Chris, which is our partner's expertise in this beverage field. So therefore, we're thinking about like maybe expanding our hours at night from 5 onwards to just do a little bit of a cocktail, liquor, beer and wine that is a little bit more easygoing, lounge feeling to it. And then we decided to start this partnership. The rest of the presentation, I'll probably have to pass it to Chris and Eleanor to tell us a little bit more about like the whole operation, but I'm gonna let them continue that.
We have Chris or Eleanor?
I think they might have some issue with sound.
Just to clarify with you, you've got no outdoor seating. Your hours are from, your open hours are from 7 a.m. to 1 a.m. Monday through Friday, and 8 a.m. to 1 a.m. Saturday and Sunday, with a close on alcohol service at midnight, 7 days a week.
We do not have any outdoor sitting, but because of COVID, the coffee shop actually has approval for open restaurant, and we finish early. So right now there is an outdoor space with barricade and build out. And depending on when we're getting our liquor license approved, when we start, if there's still a chance we can utilize the space. If not, then we don't have any sidewalk cafe.
Okay. Any questions for this application from the members of the committee?
Sorry, can you hear us now? Okay, great. Sorry about that.
Oh, we have Chris. We have must be Chris and Eleanor. Yes, I've got your you on the line here, but I just want to give the committee a chance to ask any questions off the bat in light of the hour. Okay. I would just ask you guys one question, which is that here at the Health Committee, we are very interested in local hiring, and we wanted to have you speak briefly about the number of people you want to hire and give our some available options to consider between Ingersoll Community Center, Fort Greene SNAP, and the Brooklyn Navy Yard, which are great resources in our community.
Yes, of course. So we were listening on the conversation earlier, and what Barry and Alejandro were talking about, including, local residents. Sorry. It's very important for us to hire locally and to have the community be a part of our clientele. And we would love to have the resources you have in terms of hiring locals. Some already hires 2 locals from the neighborhood out of her 13 staff members currently at Coffee Project, and of course for the cocktail bar, we're going to expand upon that. And in terms of having, we would love resources in terms of reaching out to locals to be able to find community-based programs that we could get clients in. We reached out to, I don't know if you have seen our signatures. Let me pull up our signatures here. So we went out last week and we have local business signatures, and then sorry, let me just pull up the signatures here. Oops. The coffee shop also had signatures from local residents and businesses. So we have, you can see here, some local businesses for close to 78 Rockwell. Can you also?
Can we move on for the signatures really quick? I just feel like I don't want to. I think we get that you've got the signatures. We appreciate it. It's wonderful. Sure. I know it's a difficult time with getting signatures, but if we can, I guess maybe move off of that. Thank you. All right. yeah, if we can move along from that, that would be great. I want to give the chance for the community, anybody here to ask questions about 78 Rockwell. Do we have any questions from members of the community? Any questions from members of the community? I'm not hearing any. Teo, are you able to? Are you able to advise or anyone if there are any questions?
Let's see. I don't see anyone.
Okay. All right. In that case, I'll ask the committee, does anyone wish to make a motion?
I'll make.
Approve.
Jessica jumped the gun there on you, Barry, so she gets the motion, but I'll give you the second. Any discussion on the motion? Okay, hearing none.
Well, I'm going to say my usual. I should have asked this as a question, but we assume that should any concerns come up from the community while you're in operation, you will be accepted to discussing those concerns, and if they seem to have merit, resolving them in a way that works as best as it possibly can for you as well as the people with concerns. Is that?
Yes, absolutely.
Yeah.
Okay, thank you.
Okay, I'm gonna go forward with the vote. Ms. Cobb?
Just to unmute.
Over her.
Want to vote in the meantime, Mr. Newmark?
Sure, I'll vote to approve.
Okay. Ms. Cobb?
Ms. Cobb, you are
Hello?
unmuted, so go ahead and speak. We can hear you.
Okay. Yes, I approve.
Okay. Ms. Thurston? Okay. Mr. Harrison?
John, you're on mute.
John, you have to unmute.
That's something that people have been trying to do for me for 40 years. Yes, I vote yes.
Yes. I hear that's the comment of 2020. You're on mute. Ms. McKnight?
I approve.
All right, and I vote to approve as well, too. Thank you very much for your presentation.
Thank you so much.
Thank you.
Thanks, everyone.
Thank you all. Moving right along, we got 154 Carlton Avenue, Piquin Inc., DBA Taqueria, Fort Greene. Do we have anyone here from that location?
Hello, everybody. My name is Nicolas Matias del Sal. I'm owner from Taqueria Fort Greene.
Hi, Nicola.
Hello. And I'm sorry. And this is my wife, Louie. In case I can explain in English because not language, she's going to help me to translate.
Okay.
Thank you.
Do you want to give a brief summary of your application? In the meantime, maybe we can try to pull up the actual material.
Oh, absolutely. Taqueria, I opened last December on 22nd. I used to work in Fort Greene in 2001. I know very well the neighborhood. I know it's oriented to the family. Was a tap in Lafayette and Adelphi. Also, I used to have a food truck in 2008 next to Madiba And now I have the opportunity to come back to the neighborhood and open this restaurant, Mexican food.
Okay. And just looking at your application, it looks like you have no outdoor seating and your location will be open until 2 a.m. Thursday to Saturday and 11 p.m. Sunday to Wednesday. Is that correct?
Yes. This is more for summer, spring, because I know in the winter in the neighborhood, after 10:30 is nobody there.
Okay. And clarifying, you have background music only?
Yes, only ambience for the inside the restaurant. No DJ, no kind of music like that.
Okay. Have you spoken with any of the residents in the area and what has their response been?
Well, I don't have the opportunity to talk with many neighbors for the COVID-19. What about is next to my restaurant is only one building that owns the Chinese restaurant, and I believe 90% of the attendants is the employee for the restaurant, the Chinese food.
But you did.
Well,
But he did have a signature from someone from, he got the signature from the people that live in the neighborhood, not particularly the people that live right next to the restaurant.
across the street.
The person across the street basically signed the petition. We have a petition there that was signed. And then the direct tenant, the owner, the landlord, who's the owner of the restaurant and of the building, he signed, he approved the application. And also in terms of the tenants themselves that live right next to the restaurant, they are the workers from the restaurant. So he never had an opportunity to get their signature. But we got signatures from everyone from that area, blocks around there.
Now the restaurant is in operation right now?
Yes.
Okay. With that, and right now, do you have beer and wine, or you have no license right now? Okay. Great. Have there been any concerns or expressed by any of the neighbors in the neighborhood about noise or any other issues that are coming from the existing restaurant?
No. No idea.
Any questions from members of the community for this from the committee? Any questions from members of the committee for this application?
Yes, Mr. Chair.
Mr. Harrison?
What are the cross streets?
What?
The cross street.
Myrtle, Widow.
Milton Avenue.
Yeah, Milton Avenue and Widow. It's one before the Calf.
Yeah, it's Myrtle Avenue and Carlton. I just pulled it up here on the map.
And next to us is a fire
station.
And across the street is a laundry.
So is it true that you're on Carlton between Myrtle and Willoughby?
Yes.
Next to the firehouse? Gotcha.
Next to the firehouse. Yeah, I think it's only 2 apartments there.
I know the location, surprisingly. Thank you.
Any other questions from members of the committee? Any questions from members of the community? Do we have anything for this application? Going once, going twice. Okay, I'm gonna assume there are no questions. And I'll ask the committee, do I have a motion?
So moved, Mr. Chair.
Second?
I'll second it, Brandon.
Second by Mr. Newmark, motion by Mr. Harrison. Any discussion on the motion?
Coach Ward, I second it. I second the motion.
The motion has already been seconded, Acaso. Did you have a comment you wanted to make?
No question. Sorry.
Okay, that's fine. Anyone else have an additional question on this application? Okay, hearing none, I'm gonna go ahead with the vote. Ms. Cobb?
Yes.
Mr. Newmark?
Yes.
Ms. Thurston?
Yes.
Mr. Harrison?
Yes.
Ms. McKnight?
Yes.
And I vote yes also.
Motion passes.
Motion passes. Thank you very much.
Thank you so much. Have a good night, everyone.
Thank you.
Thank you.
Bye-bye.
All right. Light of the late hour, I'm going to try to move through the rest of the agenda in a more abbreviated fashion. The minutes from our last committee meeting, which I believe was in June,
Yes.
are up for approval. Can I get a motion on that?
So
Move
moved.
to approve.
I got Barry and John. I think John gets
Yes,
the
here.
motion, Barry gets the second. I know we can't get you, Barry, you got to get quicker.
Sorry, Barry.
Any discussion on this or corrections or issues? I would just ask that you email Jessica separately. We'll just go through it really quick. Ms. Cobb,
Yes, approved.
Mr. Newmark,
Yes.
Ms. Thurston,
Yes.
Mr. Harrison,
Yes.
well, Ms. McKnight, you may wish to abstain, but I'm not asking you.
I abstain.
Okay, understand. And Mr. Smith, yes. So the minutes are approved. Going forward to chair's report, there's a lot of things I wanted to talk about, but I'm going to really put that off until next month because I know we're at a pretty late hour tonight. I thank you, Jessica, for going to the hearing on the cashless establishments. That was really great. And I really just want to encourage everybody foremost to put the district needs that you have and your thoughts into the document. You know, it really takes thinking and putting the things that we talked about from this into concrete actions going into that spreadsheet. So I really hope everybody will take the time to do that, at least put one or two things in there, and then we can have a more final critical discussion in September when we wrap things up. So with that, does anybody have any other business they'd like to raise on the committee?
Just one point, Mr. Chair.
Mr. Harrison, you had one point?
Yes.
If you could make it briefly, that would be great.
Since we are the Health and Environment and Social Services, I know it's a pain, but I'm wishing and I'm hoping and I'm strongly suggesting courteously that everybody, when they go out, even if it's just for a second, wear a mask.
Yes,
Okay.
got it. Excuse me, Brandon. I just
Sure.
like to note for the record that Mr. Andrews was unable to log in. And so at 6:19, he sort of gave up. And so his apologies and that of Ms. Richardson, who had a member of her family got involved in a car accident this afternoon.
Oh, no.
So she was unable.
certainly understandable and very sorry to hear that. And
Right.
absolutely.
All I know is she said that she was headed to the hospital. So.
Why?
Business that we wanted to raise at this point. Okay. I'm just going to say Samantha Johnson sent me these photos of this scaffolding at the NYCHA establishments. It looks enormous, but I'm going to share them around via email with everybody. Moving on to the last part of our agenda, community forum. Are there any members of the public who would like to make a statement or note their thoughts? This is your time. Okay, I'm not seeing anything, but then again, I don't know. Do we have confirmation as to whether there are any questions?
I don't see any questions. Miss Lois, nothing from you today? I recognize you. Okay.
All right. Well, with that, I'll entertain a motion to adjourn.
So moved.
Barry, you got it. You got it. Good
job, Barry.
Appreciate the speed. Can I get a second?
Second.
Second from John. Great. All right. Everybody have a nice day, and we'll look forward to seeing you at the next one. Thank you very much.
Welcome, Nicole. We look
Yes,
forward
welcome,
to
Nicole.
having you with more meetings. Maybe
Really excited to have
you.
Someday we'll be back in
Thank you
person.
so much.
Bye-bye.
Good night, everyone.
Stay safe. Stay safe. Stay safe. Stay safe. Stay safe.
Stay safe.
Likewise.